Alright, welcome back to my channel. This is Clever PC. So now let's get started. We have a client with diabetes type 1. Yes, what's diabetes type 1? So we're gonna cover diabetes type 1, and then the next episode we shall cover diabetes type 2. So with the type 1, you know that it's the issue with the insulin, and then with type 2, the problem is you. So now let's get started with type 1. Number 1, the nurse admins 25 units of insulin isophene to a client with type 1 diabetes at 1600, that's 4 p.m. Which interventions should the nurse implement? Number 1, assess the client for hypoglycemia around 18:06 p.m. Number 2, ensure the client eats the nighttime eats a snack. Number 3, check the client's serum blood glucose level. Number 4, serve the client the supper. What do you guys think is the answer? All right, when it comes to diabetes type 1 drugs and diabetic drugs, make sure you pay attention to timing. So right here we have insulin isophene, which is more of an intermediate. So you expect the effects to come 6 to 8 hours after administering. So right here we have 1600, which is 4 p.m. You expect 6 plus 1600 plus 6 to 8, that means that's nighttime. So the answer is number 2, ensure the client eats the nighttime HS snack. Yes, because by that time there will be hypoglycemia, the condition. So the patient will experience hypoglycemia at this point. So let's first look at the other options. Number 1, assess the client for hypoglycemia around 1800. This is 2 hours, which is regular insulin. All right. So this is regular insulin, so which takes 2 to 4 hours to cause the hypoglycemia effect. So that's not right. Let's go to number 3. Check the client's serum blood glucose level. Well, that's very important, but why should we check for the serum glucose level at this time? No, we have to check it 6 to 8 hours. So number 4, serve the client the supper tray. No, we shall serve this supper 6 to 8 hours. So the answer was number 2. All right, question number 2. The nurse is teaching the client with type 1 diabetes how to use an insulin pen injector. Which information should the nurse discuss with the client? Number 1, instruct the client to dial in the number of insulin units needed to inject. Number 2, demonstrate the proper way to draw up the insulin in an insulin syringe. Number 3, discuss that the insulin pen injector must be used in the abdominal area only. Number 4, explain that the traditional insulin syringe is less painful than the injector pen. What do you guys think is the answer? All right, whenever you think that I'm so fast, kindly pause so that you can literally get the true meaning of the question and the options. All right, looking through, number 1 was the answer. First, look at the question. The question is how to use the insulin pen injector. So your answer should be tailored to this answer. So instruct the client to dial in the number of insulin units needed to inject. So remember, an insulin pen injector has already a set amount of already a pre-filled amount of insulin. So it's just the patient to just literally dial in the number of insulin units needed per the doctor's order, and then they will need to self-inject that medication on their own. All right, so let's first look at the other options. So the answer was number 1, instruct the client to dial in the number of insulin units needed to inject. Let's look at the other options. Number 2, demonstrate the proper way to draw up the insulin in an insulin syringe. No, there's no need to draw up the insulin. Remember, like I said, an insulin pen injector already has a set amount, or it's already pre-filled in the factory. All right. So number 3, so this is the traditional insulin syringe, which doesn't answer the question. Number 3, discuss that the insulin pen injector must be used in the abdominal area only. Guys, what did I say about any answers that have only? in most cases, it's going to be the wrong answer. So, and moreover, it's not even injected, in as much as the most common way is the subcutaneous fat in the abdomen. You can even use other areas, all right? For instance, the outer thigh, in addition to the abdominal area, in as much as the abdominal area is the most commonly type and it has the most rapid absorption. So it's on the area area. Number 3 is wrong. Number 4, explain that the traditional insulin syringe is less painful than the injector plan. It's actually the other way around. This insulin pen injector is much less painful than the traditional way. So number 1 is the answer. Alright, number 3, the nurse is teaching a client with newly diagnosed type 1 diabetes about insulin therapy. Which statements indicate that the client needs more teaching concerning insulin therapy? Select all that apply. What do I often say about SATA questions? Select all that apply. You treat each option as either true or false. So when we look at this question, it says which client needs more teaching. More teaching means like which one is the wrong answer. So which one should we which option should we tell the client that, hey, this is wrong, we need to correct this? So let's first look at the question. The nurse is teaching a client with newly diagnosed type 1 diabetes about insulin. Which one needs more teaching? Number 1, if I have a headache or start getting nervous, I'll drink some orange juice. Absolutely. These are typical signs of hypoglycemia: headache, nervousness, jitteriness. These are typical signs of low blood sugar. So definitely the client has to get some sort of some glucose somewhere. So orange juice, absolutely. All right, let's look at the other sections. So let's first look at the question, which one needs more teaching? So this one should not be included because it's right. Remember, we are looking out for the wrong answers. All right, let's look at the second one. If I pass out at home, a family member should give me a glucagon injection. Of course, that's what you have to do. Remember, glucagon is the opposite of insulin. Insulin decreases the blood glucose, whereas glucagon increases in the what? On the blood glucose. So basically right now we literally just need to cancel out number 1 and number 2. Let's go to number 3. Remember, we are looking out for the wrong answer. Which statement indicates the client needs more teaching? Number 3, because I am taking my insulin daily, I do not have to adhere to a diabetic diet. No, you usually need to continue with this diabetic diet even if you're on any anti-insulin anti-diabetic drugs. So number 3, yes, you choose number 3. Let's go on. Number 4, I'll check my blood glucose with my glucometer at least once a day. Yes, absolutely. You need to constantly check this blood glucose at least more than once a day. Number 5, I should administer my insulin in my abdomen for best absorption. This is correct. Number 1, number 2, 4, and 5. If the patient says this, they are correct. But remember, we are looking out for the wrong answer. So number 3 was the only one which was the answer here. All right, number 4, the nurse administered 12 units of regular insulin to the patient with diabetes, type 1 diabetes at 7 a.m., which meal prevents the client from experiencing hypoglycemia. So they gave regular insulin at this time 7 a.m. So which meal will prevent the patient from experiencing hypoglycemia? We have number 1, breakfast, number 2, lunch, supper, and then a snack, nighttime bed snack. What do you guys think is the answer? All right, remember right here we have regular insulin. So how long does regular insulin take? It takes 2 to 4 hours. So the best option was number 1, breakfast. All right. Yes, because breakfast is often from 7 to 10. So within a 2-hour window, you recommend the patient take breakfast because of the hypoglycemic effects that will set in. All right, number 5, the client diagnosed with type 1 diabetes is reporting a dry mouth, extreme thirst, and increased urination. Which interventions should the nurse implement? Select all that apply. Guys, how do we handle or select all that apply? By either selecting true or false. So here we have the client is diagnosed with diabetes type 1 and reporting these symptoms. So which intervention should the nurse implement? What are these symptoms, guys? Dry mouth, extreme thirst, and increased urination. Whenever you see increased urination, which is polyuria, think about increased amount of what? Amount of glucose. So that means this client is in a serious diabetic state, which is more of diabetic ketoacidosis, because right now we are in type 1 diabetes. So how should we manage this? Let's look at the options. Number one, administer 1 ampule of IV 50% glucose. Oh wait, we already have a lot of glucose. So why should we even add more glucose, guys? So throw that out. Number two, prepare to administer IV regular insulin. Absolutely, guys. Yes, you gotta administer this insulin so that this insulin can take back this high amount of glucose into the cells. All right. Number three, inject insulin as often subcute into the abdomen. What do you guys think is the answer? So this one is wrong. Remember, isofen is what is an intermediate. This will take so long, 6 to 8 hours. This is an emergency, ladies and gentlemen. So just throw this out. This is an emergency. This patient is in diabetic ketoacidosis. Number four, hang an IV infusion of dextrose 5 at a keep open rate. This one would be right if it would be combined with insulin, but however, it's a standalone, so throw that out. Number five, check the client's blood glucose level via a glucometer. Absolutely, you gotta check this blood glucose level as you control it with IV regular insulin. So here are the answers on number 2 and number 5. Alright, number 6, the client newly diagnosed with type 1 diabetes asks the nurse, why should I get an external portable insulin pump? Which statement is the best? Is the nurse's best response? Number 1, it will cause you to have fewer hypoglycemic reactions and it will control blood glucose levels better. Number 2, insulin pumps provide an automatic memory of the date and time of the last 24 balances. Number 3, the pump injects intermediate acting insulin automatically into the vein to maintain a normal blood glucose level. Number 4, the portable pump is the easiest way to administer insulin to someone with type 1 diabetes and is highly recommended. What do you guys think is the answer? Alright guys, if I'm so fast, kindly do what? Pause before you miss out. Alright, the best answer was number 1. So why should I get an external portable insulin? What's the nurse's best response? It will cause you to have fewer hypoglycemic reactions that will control your blood glucose levels better. Absolutely, the patient better gets this portable insulin pump, because anytime the hypoglycemic, reactions, well, it's more easy to control, the diabetes with an external portable pump, since it's self-managed by the client instead of having to rush to the doctor. So it will cause you to have fewer hypoglycemic reactions and will cause to control blood glucose levels better. Absolutely. Let's first look at the other options. Number 2, insulin pumps provide an automatic memory of the date. No, this is wrong. They don't give an automatic memory of the date. No. Number 3, the pump injects intermediate acting insulin automatically into the vein. No, it often actually gives what? It often gives a rapid, the fast acting insulin, not the immediate acting. Number 4, the portable pump is the easiest way to administer insulin to someone. No, it's not the easiest way. Actually, it needs some technicalities. That's why most patients, they often use the traditional way, and with the time they graduate to the external portable insulin pump because this one is self-managed. So the answer was number 1. All right, number 7, the nurse in the medical department is prepared to administer insulin Lispro to a client diagnosed with type 1 diabetes. Which intervention should the nurse implement? Number 1, ensure the client is wearing a medical alert bracelet. Number 2, administer the dose according to the regular insulin sliding scale. Number 3, assess the client for hyperosmolar, hyperglycemic, non-ketotic coma. Number 4, make sure the client eats the food on the meal tray. That's at the bedside. What do you guys think is the answer? All right, ladies and gentlemen, whenever you find a specific, anti-diabetic drug that's given, think about the time. So right here, interventions, what should the nurse do? Right here, we have ensure the client is wearing a medic. The client is already admitted in the medical department. That means we expect them to wear a medical alert bracelet. Number 2, administer the dose according to the regular insulin sliding scale. Don't really, because of this drug. Remember, this pro is a fast-acting anti-diabetic. That means you expect effects to come in 30 minutes to 1 hour. So that means the best answer right here was number 4. Make sure the client eats the food on the meal tray that's at the bedside. So as you're giving this drug, you make sure the patient is actively having the food right there and then to mitigate or even prevent the hypoglycemic effects. So number 3 here, we had assess the client for hyperosmolar, hyperglycemic. No, there were no signs and symptoms that are given to show this condition, all right? So, and moreover, this condition is in type 2 diabetes. Type 1, we have the ketotic one, which is DKA, diabetic ketoacidosis. But right here, this one is only in type 2 diabetes. So the answer was number 4. Number 8, which assessment database indicates the client with type 1 diabetes is adhering to the medical treatment regimen? Number 1, the client's fasting blood glucose is 100 milligrams per deciliter. Number 2, the client's urine specimen has no ketones. Number 3, the client's glycosylated hemoglobin is 5.8%. Number 4, the client's glucometer reading is 120 milligrams per deciliter. So what shows that the client is compliant to the medical regimen? What literally shows what's the HCP? What test is the HCP gonna determine? Alright, this one was straightforward. So the answer was number 3, the client's glycosylated hemoglobin. So whenever you girls see high glycosylated hemoglobin, this is the best test to measure the client's compliance to the diabetic medical treatment regimen. And the normal is 4.0 to 5.5, and 5.8 is just near 5.5. That means the client has actually been compliant. So if you look at blood glucose is just to measure the amount of sugars at that point, but not for a long time, all right? Then you look at number 2, it has no ketones. No, we're in type 1 diabetes, so that's expected. If you look at number 4, client's glucometer reading is 120 mgs. The normal one is 70 to 110 mgs per deciliter. So this one was way above. So the best answer was number 3. So whenever you read this question, adhering to the medical treatment regimen, think of glycosylated hemoglobin. All right, number 9. This is the second last. The nurse is discussing storage of insulin vials with the client. Which statement indicates the client understands the teaching concerning the storage of insulin? So how do we store insulin? Number 1, I will administer my unopened vials of insulin in the refrigerator. Number 2, I can keep my insulin in the trunk of my car, so I will have it at all times. Number 3, it's all right to put my unopened insulin vials in the freezer. Number 4, if I prefill my insulin syringes, I must use them within 1 to 2 days. What do you guys think is the answer? Alright, the best answer was number 1. I will keep my unopened vials of insulin in the refrigerator. So it's very okay to keep these vials of insulin in the refrigerator, but not the freezer like number 3 had said, alright? So, and you can actually keep them for 1 month in the refrigerator. So you can literally use them within 1 month, alright? 1 to 2 weeks, you can definitely use them. So, whereas number 4 said, if I pre-fill them, I must use them within 1 to 2 days. No, you can even use them for 1 month, alright? So, the best answer was number 1. Let's look at number 2. I can keep my insulin in the trunk of my car. No. High temperatures do spoil the potency of what? Of insulin. So throw that out. So the best answer was number 1. Number 10, which statement best describes the pharmacodynamics of insulin? Guys, before you even read these options, first understand the question. Answer the question in your mind before you get confused by these options, alright? So when you think of pharmacodynamics, what rings in your mind? There's also pharmacokinetics. So which formula do I use? Let me tell you the answer. First read the options. Number 1, insulin causes the pancreas to secrete glucose into the bloodstream. Number 2, insulin is metabolized by the liver and muscle and excreted in the urine. Number 3, insulin is needed to maintain colloidal osmotic pressure in the bloodstream. Number 4, insulin lowers blood glucose by promoting use of insulin in the body cells. What do you guys think is the answer? How are the pharmacodynamics of insulin? Alright, ladies and gentlemen, the best answer was number 4. Insulin lowers the blood glucose by promoting use of insulin in the blood cells. So, pharmacodynamics refers to mode of action of the drug, whereas pharmacokinetics refers to the metabolism of the drug. So, just the best mnemonic is dynamics, which has A, so mode of action, whereas kinetics has E, which is the metabolism of this drug. So when you look through the options, what was the pharmacokinetics? Pharmacokinetics was insulin is metabolized by the liver and muscle and excreted in the urine. That was the pharmacokinetics. Then pharmacodynamics is the mode of action. By this I mean, how does insulin work in the body? Insulin works by lowering the blood glucose by promoting use of glucose in the body cells. So insulin is like the gateway of allowing glucose, this excess glucose, to enter into the body cells, which was number 4. So right here, the answer was number 4. If you look through the other options, number 1, insulin causes the pancreas to secrete glucose into the blood cells. This is absolutely wrong. In fact, insulin lowers blood glucose, whereas this insulin is secreted by the pancreas. Number 2, insulin is metabolized by the liver and muscle and excreted in the urine. That was the pharmacokinetics. Insulin is needed to maintain colloidal osmotic pressure in the bloodstream. No, it doesn't do this. It's the albumin that's produced which is secreted by the liver that does this. Alright, so the best answer right here was number 4. Alright, ladies and gentlemen, that marks how many did you get out of 10 plus? Please guys, write in the comment section how many did you get out of 10. And don't forget that we have rapid acting drugs, regular, intermediate. So rapid, we have this Humalog, and then we also have Novolog. So this one acts 30 minutes to 1 hour. We also have regular, which acts between 2 hours to 4 hours. And then intermediate, I give an example of Isophene. These ones act 6 to 8 hours just after administration. So ladies and gentlemen, next we are gonna go through type 2 diabetes and diabetic drugs. You have to master that pharmacology All right, and thank you so much for watching, ladies and gentlemen. See you in the next, and make sure you subscribe so that you don't miss out on these episodes. All right.